is Moran. Clinically, I am trained as a geriatrician and I work clinically at the Alfred in Victoria. I'm also an associate professor of health services research at Monash University, and along with Professor Kathy Mihalopoulos, who is trained as a health economist, we're both the co-directors of the Masters of Health Management. So over the next few slides, really what I'm going to do is give you a little bit of an oversight about what exactly the course entails, how the course is structured, and a little bit about what to expect. The course is recognised by a number of the key peak bodies within Australia. For those who are medically trained, the recognition through the Royal Australasian College of Medical Administration is particularly important for people, as is the recognition that we have from the Australasian College of Health Service Management. And our course has been developed and is taught by some of Australia's most senior and respected healthcare management managers and policy academics. And I suppose in recognition of the expertise that we think that we have and the quality of the education that we provide, we're a preferred provider of health leadership training by the Victorian Department of Health. The course structure is divided into three main parts. Part A being that of foundational knowledge, Part B then being a choice of different courses or different units that you can choose to help you round out your own training, and then Part C being additional electives that you can choose to do depending upon what your particular interests are currently or where you'd like to position yourself with your education and qualifications for the future. There's a wide range of different kinds of courses that are core units as well as elective units, and they cover the breadth really of what would be expected from someone to be a leader in the space of health management and leadership, covering areas such as patient safety, clinical leadership, finance in the healthcare setting, the use of digital technologies in health and health leadership, health law, research methods, including quality improvement methods, and health economics. And the approach that we have allows you to choose whether or not you want to take a full-time study approach or a part-time study approach. And the way that we deliver this is a blended approach using a combination of online and in-person days to give you as much different ways of learning that will hopefully fit to your preferred way of learning. There are two main offerings that we provide for the masters, and that really is dependent upon the kind of expertise and clinical or leadership work experience that you bring to the role. So for those of you who have at least 1 year of relevant work experience and have the bachelor's degree or equivalent in a discipline that's related to leadership and management or in the healthcare setting, there's a 96 credit point unit. And you can see here on the table below, in a full-time, that's completed over 2 years. And in a part-time setting, that is over a 4-year program. For those of you who have at least 2 years of relevant work experience with the similar qualifications, that is a shorter amount of time taken to complete the units and therefore complete the entire course. Full-time, that's 1.5 years of full-time study. Part-time, which is the more common way that people will do it, is over a 3-year period. You may have seen in your reading that there is also available on the website a Masters of Health Administration. I thought it'd be useful just to compare that if some of you have come across that in your reading. The Masters of Health Administration is a master's that's delivered purely online without any of the face-to-face component. It consists of 12 units. There's less options with regards to elective units in that course, and that's completed over a 2-year period. All three options are completed within a maximum of 6 years to complete that course. This slide presents the course structure for those who would be considering enrolling in full-time. And you'll see the different versions of this on the website if you go looking at it. I just thought I'd show you this to give you an idea of the structure of the units. So you can see, for example, if you start in year 1 and semester 1, that you can start with those core units that you can choose from. And on the right-hand side, you can see those 3 units, your options to complete those 3 units. So epidemiology, biostats, research methods, etc. You can see it on the right-hand side before moving into those core units. So for example, the health economics, and then moving into the second semester of year 1, law for health systems, clinical leadership and principles of health system. And you'll see as I show a couple of different constructs of this, at the very end, what you have in the bottom right-hand corner of the table is a case study in health services management, which is a 12-point offering, and I'll talk a little bit more about that later on. For those who have more than 2 years work experience, the entry for that is a 72 credit point, and this just gives you that extra understanding of what happens if you're entering at that slightly shorter duration of course. So in this case, you go straight into the core structures and the core units, foundations of health policy and the financial management, etc. You can read those there. And then you can see where the electives come in with regards to semester two, or sorry, forgive me, year two and semester one, with the same list of electives that you can choose from depending upon your own educational needs. This shows how the carousel will be set up for those who would be considering doing this as a part-time rather than a full-time enrollment. So again, the structure is the same, but it allows you different entry points and just shows how this is staggered out a little bit more. So you're not taking on as many concurrent units. You're taking on 2 concurrent units at any given time rather than in the full-time setting, with the choice of units exactly the same. Because of the nature of this unit, we do prefer that people have some professional experience prior to applying to enter this course. And part of that's related to the case study in health services that we have as a capstone unit at the end of when you're exiting this course. The case study really requires you to apply what you've already learned throughout the rest of the course, to apply it to a problem in your local setting. So the advantage of this is taking an authentic assessment approach where you identify a problem that's relevant to you in your local setting, and then take the skills and expertise that you've learned throughout the remainder of the course and apply it to an attempt to solve the problem or describe a report of how you'd attempt to solve your particular problem that you've identified. The kinds of people who consider this course and the Masters of Health Administration are really those who are either in or considering stepping into leadership roles in health services or in health-related organizations. And they come from a variety of backgrounds: medical, nursing, OT, allied health in general are common applicants to this course. And often people in this setting already have employment in the healthcare setting, and they're using this as an argument for or to support a promotion. However, these skills are quite transferable to those who are interested in taking on additional leadership roles, either within the healthcare setting or related to that, for example, in departments of health. I'm more than happy, as is Kathy, to take any kinds of questions that you have either today or to email them through. And depending on the nature of the question, I've just put some email addresses up there for you to email us with any kinds of questions that you think that we can help with to help you understand whether this is the course for you. And that's the end of my formal bit of the talk. So I'm happy to take questions, but I'll hand you over to Joanna to talk a little bit about the Masters of Health Analytics.
Joanna, you're on mute.
That means I probably owe somebody a drink or something, or chocolate, because I've been on mute. So sorry about that. Hi, I'm Dr. Joanna Dipnall, and I'm one of the course directors for the Master of Health Data Analytics. The other course director is Professor Andrew Forbes. And I'm just going to go through, my presentation is going to be slightly different. And I'm going to turn my video off because I might have some instability in my with my internet, so please excuse that. So first, I'm actually going to set the stage about health data analytics, and because then you'll understand why we've set up the course the way we have. We all know that big data analytics is growing, and the market size of this is growing as well. If we have a look at this graph, this is from Fortune Business Insights, we can see that they had projected that by 2032, this market is going to grow up to $924 billion. And healthcare has long been one industry that frequently hires data analysts, and it's no different now, and it's growing, and it remains a promising industry. So healthcare analytics The market is growing and it's got a big share. So if you have a look at this graph from Fortune Business Insights, apart from banking, financial services and insurance, that's the BFSI, the healthcare share of market in big data analytics is quite large. If we have a look at a healthcare data analyst in Australia, the Salary Explorer, which is a group, an organisation that looks at how salaries grow and what they're made up of, indicate that if you end up with a master's degree in healthcare data, as a healthcare data analyst, they project that you will increase your salary from a bachelor's to a master's in this area by over 50%. So the benefits of health data analytics course is also not only in the skills you acquire, but also the ability to obtain a higher level job. So with this master's course, it's really suited to undergraduates who want to expand their career in health analytics. So it's targeted to a variety of graduates, to health-related graduates that have a degree with health, that are keen to expand their quantitative methods. It's also ideal for graduates of maths and statistics degrees that want to expand into the health arena, as well as those in computer science and IT. And you'll see why that's the case when we have a look at the mix of units. It's also really good for health researchers or practitioners who are actually wanting to enhance their quantitative skills or even change their profession directed towards more health analytics. And of course, data scientists wanting to enter and specialize the health domain. In data science, it's quite a general area. If you look at the Master of Health Data Science, ours is really has a bit of that angle, but also focused on health. So what are the skills you're going to get if you did a Master of Health Data Analytics? Well, you're going to get advanced expertise. So we know that this area of health data science is growing, and the demand for graduates with these skills and knowledge in areas such as epidemiology, biostatistics, machine learning, data wrangling, and programming is what you'll be getting and what they look for. You're also going to get expertise in key aspects of health data analytics. Now, I know that a lot of organisations are wanting people who know how to program in packages such as Python and R, who understand statistical inference, who know about regression and machine learning modelling for their health data. And that's what you'll get. You also have the ability to tailor your specialisation to either biostatistics, machine learning, or you might just want to complete the general stream in health data analytics. And on the website, it's got details of that, and I'll go through that a bit more here. So here's the course map. So we have a mix of units from the School of Public Health and Preventive Medicine, from the Faculty of IT, and also the Faculty of Business and Economics. That's because we're talking about health data analytics. And so therefore, it's on campus at the Alfred Hospital, Caulfield and Clayton, both full-time and part-time, and also has a blend of online and in-person learning. So in the first year, in semester 1 and 2, you'll be doing a variety of units, core units. And these core units will include an introduction to health data analytics, some programming in Python, both within our school and in the Faculty of IT. That's the second semester. You'll also get a foundational understanding of biostatistics, which is here. That's a fully online course. Introduction to epidemiology, and there are a couple more in second semester of biostatistics. In the second year, sorry, what you will do some a core year angling, human health and disease, get involved in. Second,
Sorry, is anyone else
project.
having
We picked
just
one to work with some researchers, case study. It is full-time. Yeah, sorry.
Sorry, Joanna, that was me, Kirsten. I was just having a little issue hearing you. So it might be worth just repeating for others what you said, just starting on this slide.
Okay. Can you hear me now?
It's a bit disrupted. Shui,
are you able to hear me?
Are you hearing?
Yes, I can hear you, but it is a bit disrupted. Like
I'd
you
say
are
maybe
yeah.
let's just try it again from the top of this slide and see how you go, Joanna, because it was quite good until then.
On this slide here, year 2.
Correct. Shui, are you able to hear Joanna?
No. Think she may be reconnecting.
Maybe let's just give her a minute and see
Yeah.
what
Yes.
happens.
Yep, we'll wait for a while. If not, I think Sid is ready to jump on as well. So just give it a couple of minutes. So sorry, everyone. But if any of you would like to ask your questions, it is a good time now. And Chris, as well as Andrew, who is online, is more than happy to help answer any queries you have about the course or even the student experience. Hi, Andrew.
Hello. I could
Andrew, since
probably
you're
continue
here,
with the presentation. If
you can you?
yes, I haven't got the slides, but did Joe have the slides, or did you have the slides?
I might
I'm
jump
certainly
in with a question while Shui
Yeah,
is
sure,
having a
absolutely. Yes.
look for those, and maybe we wait for Joanna for a couple of minutes anyway. Shui, if you want to have a look and see if you've got the slides there.
Yes, I will
In the
have them loaded
meantime,
up.
Andrew, just wondering, maybe you could talk very quickly to how this this course differs from the Master of Biostatistics and how someone might sort of make the choice between the two.
Yeah, sure. Yeah, thanks, Kirsten. That's a great question, because I can appreciate when people are looking at these courses, they say, well, it's got the health data analytics, it's got a bit of biostatistics, it's got a bit of IT, there's some business and economics units in there, and it's all, a bit confusing there. The biostatistics is more sort of research oriented, to be honest, that it's more geared towards working as a biostatistician in a research environment. That may be that might be in private industry, that might be in the university, that might be in sort of government facilities, but it's looking at, it starts with sort of a theoretical basis of statistics and then works very much in sort of traditional techniques in biostatistics like modeling, whereas the health data analytics is actually the more progressive to the current workspace of big data, and there's lots of big data in the health arena. And to handle big data, you really good programming skills, managing large amounts of data. And then a lot of the aspects in with big data is trying to predict based on what we see on these patients, what's going to happen to them in the future, or people in a private health fund, who are the ones who are going to be making the greatest health claims in the future. So there's a huge focus on prediction of the future based on the data that we've got now. And that's very much in the area of the machine learning that is covered much more extensively within the health data analytics than within the Master of Biostatistics degrees. So they've got slightly different focuses. One, the health data analytics is really much more focused on big data that arises in sort of large healthcare databases, whether they're in registries, private health insurance databases, government databases, or even in industries where they've got information on a whole lot of people and want to know really what's going to happen in the future.
Thanks so much for that,
I'd say
Andrew.
the big differentiating factor is the handling of big data and the big focus on the prediction of the future elements.
No worries, that's really helpful. I think Joanna
Sorry
might
about
be
that.
back online. That's okay. Did you want to give it
Just-
another go, completing the rest of it? And if you do have any more problems, Andrew can step in.
Yeah, sure. I shouldn't. I've run for a different connection, and hopefully that's fine. It was working all right. Is that better? Are you
It's
hearing
good
me a
for
lot
me.
clearer? Oh, good.
It's good
that
for
that
me.
makes it easier. Is that my sharing or is that someone else's sharing?
Shui's sharing this, so
Okay,
she could
Shui,
drive. So perhaps if you
yeah,
just
you
keep
drive.
saying next
That's a good
slide.
idea. Okay, if you just click on to the next, if you press on, you'll see the. Did you go through? I think we got to the project, the next for the second. There, that's right. Okay, so I think Andrew's probably, I missed some of that, but these are the electives where you can actually decide to, if you just press the space bar 3 times, if you like, yeah, where you can decide whether you want to specialise into biostatistics or machine learning, or a mix of those and communication for a general stream. And the students have been, some have this year have selected, the machine learning, deep learning, semi-structured data, and others have gone down the path of biostatistics and done things like longitudinal data analysis. Next slide, please. And employment opportunities. So if you just click on the next one, please. We might skip this video if you want to go to the next, because I think you can put that in for students, for people who are keen. Is that right? You lost, I'm having a lot of luck tonight. So let me see if I can share mine, because it might work. Can you share that? Does that work, everybody?
I can see it.
Yes,
Yep.
sorry.
Okay, that's right. I think yours just died. Okay, so, opportunities. Health data analysts are needed by private health funds, hospitals, pharmaceutical organisations, government. There's a lot of government, both state and federal government. Us here in academia, of course, private enterprise, and they do all sorts of things. Some examples would be monitoring public health. COVID pandemic's a good example of monitoring public health. We're all very aware of those and the big data dashboards that came out of COVID. Running models, machine learning models, traditional statistical models, analysing electronic health data, all sorts of things. I'm going to skip that video for the sake of time. But today I went on Seek and had a little bit of a look around for you all, just to get an idea of some different types of jobs and where they would be and what organisations. And I pulled out a few of these, and they're just a few to say, well, the type of work that you'll be able to get after this will be things like programming, statistical programming with analytical skills, going in, doing analytical work or biostatistics work, having a look at organisations that are from hospitals, Royal Children's there, right through to Hearing Australia, and across and in different locations, South Australia, Queensland, and Melbourne. So at the end of this degree, we're going to equip you with a relevant postgraduate qualification. I showed you how, with masters, you already got a leg up for a higher job, higher paying job, and areas of public health, statistics, data analytics, epidemiology, with a focus on the quantitative research methods. You're going to have a really good advanced conceptual and analytical skill set that you'll be able to take to your next job, next role. You'll have a knowledge with strength in research and statistic methodologies. And I know organisations in health want people not just that can program, but can understand health data. You'll have experience in the analysis and interpretation of health data. As I said, in semester 2, there's a practical component where you'll be doing a project, either with some researchers or as a team. And you're going to get a skill set of knowing how to program in packages such as R and Python, which you have a look that a lot of organisations are wanting, and they're fantastic programs. And of course, on top of all of that, you're going to be able to expand your writing and communication skills. So I want to thank Sid for coming. He's a fantastic second-year Masters of Health Data Analytics student, and he's going to go through some background, why he chose this course, some of his experiences, and his future after the course. And I'm going to leave and thank everybody. And there's my email and Andrew's email that you can contact us directly, and hand it over to Sid.
Thanks, Joe. Hi, everyone. I'm Siddharth. I'm an international student currently in my second year of the Master of Health Data Analytics course. My background is in medicine. I worked for a few years as a GP in India and a few more years as a radiology resident. Before doing a brief stint at Accenture, that's where I came into contact with AI and tech, and I was interested to learn more about the use of AI and different models in healthcare. That's why I chose this course. And what I like about this course is that the first year you spend time picking up skills in programming, coding, and also learning about the mathematical foundations that are required for you to understand machine learning in a better way. So that's the first year. The second year, I chose to go down the machine learning pathway since I was interested to know about the different models. Of particular note, I like the units relating to machine learning, deep learning, and natural language processing. Um, Sorry, I forgot to mention that I also work part-time in a health tech startup, and I work with these large language models, for example, the ones that are used in ChatGPT and the like. And what I learned from these units is a very deep understanding of how these models work and how they can be trained and developed. For example, in the semi-structured data unit and the natural language processing unit, I learned how these large language models actually work and how they can be developed. And then in the deep learning and machine learning units, I was introduced to the basic concepts of machine learning and more advanced techniques like neural networks that are state of the art models today. Um, in the future, I'm hoping to use the skills that I've picked up in this course to be able to work in health tech startups like mine and a few others that are in this healthcare space and developing models for use in medicine. For example, I'm interested in models for computer vision, and we learn about those in the deep learning unit, where we're taught about vision transformers and CNNs and other models that we use, for example, in radiology. I'm also interested in working with models like in medical scribes that use AI and the like. Um, I think that's it for me. Thank you.
Thanks, Sid. Joanna, I think we received a query in the chat in regards to explaining the second year units again, because there was a bit of disruption back there.
Just unmute, Joanna.
I'm doing so well tonight. I'll just show that.
All right. In the meantime, I'm just going to quickly launch a poll while Joanna sets the slide up. This poll is just to get to know the audience a bit better, as well as find out how you have heard about the event tonight. And if you could just quickly answer that, wouldn't take too long while Joanna sets her screen up.
Okay, I'll just make sure I share the right one. Sorry, guys. How's this? Everybody see that?
Yes, perfect.
Okay.
That's all good. We'll just let the poll run for another moment or two.
Yeah,
And then, yeah.
let's just give it a minute if that's all right.
That's no problem at all.
Joe,
Yeah.
Maida here. One of the other questions that I think Ria had was how this course differs to other health data analytics courses.
Can they be specific about other health data analytics courses? This course focuses on, also encompasses units from the Faculty of IT, and we bring together expertise from that domain. Can they expand on what they're wanting to? I'm not sure. Andrew, do you know what that might be?
My guess again, I'm not sure. As far as I'm aware, there is no other course called
That's what I thought.
Master of Health Data Analytics in Australia. There is a Master of Health Data Science, which is really like a Master of Biostatistics with a little bit of machine learning thrown in. Our course has much more machine learning and programming and handling big
the Faculty
data
of IT.
than that course does. But there are some other ones that are more like a Master of Digital Health, which are more about the technologies rather than the data analysis. So I'm not aware of any
I'm not
other
aware of
course
any
like ours.
If they can point us, we can. I'm quite happy if they want to email me separately, if they want me to have a look at a course that they were thinking about, and I can sort of target a bit more for them, if you like, Maida.
Oh, thank you, Joe.
That's okay.
All right, thanks everyone. I'm just going to end the poll so that Joanna can continue with her with her presentation. All right, thanks everyone. All right, back to you, Joanna.
Okay, I think the question was wanting to look at year 2 because it was broken up, it had a problem with the internet. And in year 2, we have 3 electives, which I went on to the following slide. Oh, I keep getting a slide. Yeah. But we also, in the first semester, you do from the Faculty of IT, a foundational, really, everybody needs to know in health data analytics how to what's called wrangle the data. And this data wrangling is often a core unit for future, some of the other units that Sid was talking about. You also get a unit in human health and disease processes. And that's a health, it's self-explanatory what it's talking about, and an introduction to machine learning. And that introduction of machine learning allows you to then sort of step into other more advanced machine learning units that you may choose to do. The second semester you do mandatory professional practice development, and the unit in the EPM, this unit here, EPM 5031 or EPM 5032, the Health Data Analytics Project, we select some students to work with some researchers. This semester, we've got 4 Master of Health Data Analytics students working on projects. One with a researcher that works with us and also with Origin. A couple are looking at trauma registry data, and another student working on with some work with Burnett. And the EPM 5032 is a group project. You get given some data in groups and you work on the project with doing some machine learning models with those data and writing a report. So they're hands-on work. You hands-on program both of those units. You have to wrangle your data, you have to run some machine learning models, you have to interpret and report on them. And then the 3-part C units are the different, as you can see here, different streams where you can select the biostatistics in some units in biostats or in machine learning, like Sid talked about deep learning and NLP. That's where he would have chosen, or the general. And I think that's these here. That's where Sid was talking about some of the ones that he did here. I hope that's answered the question.
Thanks, Joanna. Yeah, if you've got any other questions in regards to the course structure, feel free to pop them in the chat. We've got another question which is for you, Joanna.
Yep.
It's in regards to comparing the degree with another university's health data science degree. Would you know what the difference would be comparing it with another university? So in this instance, the university quoted was UNSW. Would there be any difference, in terms of job outcomes and the course itself?
Well, of course, ours is a lot better. But I think Andrew's going to pop off that one. You can see him.
Yes, I haven't. Yes, so Uni of New South Wales Master of Health Data Science is, I believe, the closest one, and that's the course I mentioned before. That looks like to be very closely based on the Master of Biostatistics, with some analytics aspects to it, with a smattering of, say, machine learning. But we would have double the amount of sort of large data handling in our course than in their course. So theirs is mostly biostatistics with some analytics in it, whereas ours, we've got the common core of the biostatistics. There are 3 units that are common to the Master of Biostatistics and the Master of Health Data Analytics. But once you've done those, you're free to go down the whole machine learning analytics path, whereas theirs is much more biostatistics focused. Yeah.
I don't think they have deep learning specifically and things like that, Andrew. Which is
look, I think we should confess we probably haven't looked at their program for about a year.
Yeah, I haven't looked for 2025.
It may have changed. Yeah.
But I'm going to after this.
Yes, we certainly will. And we'd be happy, if you want to leave your information, we'd be happy to look at the program and then send you an email with just being more specific about how our course differs from the UNSW one.
All right, thanks, Andrew. Thanks, Joanna. The next question we've got is, what is the criteria for being chosen for the analytics project?
It's performance based. We have a look, by that stage you would have done the majority of your core units, and we also would look at the nature of your units to match you up with the projects. That's the other thing as well. Yes.
All right, thanks, Joanna. Another question that we've received is in regards to number of hours that students will be required to be on campus per week.
Right. There are, depending on, some of the core units, like if you think of first semester, 3 out of the 4 units will require you to attend tutorials in person. The biostatistics ones don't. So that's 1 in first semester in first year and 2 in second semester in the first year. The other ones require you to come in person for either the Faculty of IT is like a flex, they call it flexible. So you have some hours that are face-to-face and some online. But 3 of the units in the first semester, you would be required to do 2-hour tutorials. So there'd be about 6 face-to-face. It depends, but the others also depend on what you choose.
Thanks, Joanna. And what about Chris for the Master of Health Management?
With regards to hours,
Yes, in regards to the health management degree.
obviously it depends on the unit itself. Some of the units are more coursework heavy, while some are more interacting with colleagues on forums and things like that. So it really depends. It's hard to be specific on that. Unfortunately, it does vary quite a lot from unit to unit.
Yep, thanks, Chris. All right, so we did receive another question, Chris. This is for you as well. It's in regards to having a medical background in order to be eligible for the MHM degree. Like, do students need to have would having a clinical background benefit them in the degree?
It would. It's not a requirement, but it would. It certainly doesn't need to be a medical qualification. I can't see the exact question that was answered. It certainly doesn't need to be in medicine. An understanding of healthcare would be ideal. And that's one of the reasons why we encourage people who have at least 1 year of experience of working in the healthcare setting. Most people who do this course have some kind of healthcare background, and usually that's clinical. But every year there's probably about 10 to 15% within that cohort that would have a healthcare background but wouldn't be clinical. So, for example, perhaps an understanding of billing practices, or have helped with hospital coding with discharge summaries and things like that, or have a policy and planning background within healthcare if they're coming from departments of health or other areas like that. So an understanding of how clinicians work in a healthcare setting would be extremely useful. You don't necessarily need to have a qualification or a medical degree to enter, not at all.
All right, thanks, Chris. In regards to the health data analytics degree, Joanna or Andrew, would a student having a clinical background benefit as to if they're doing the course?
Well, I think Sid was a good example of somebody that has. One thing that is useful is you do need to have some form of quantitative background, and medicine does lend itself to that as well.
All right, thanks,
Andrew,
Joanna.
unless you want to add anything.
No, I think that's fine. We can continue on, sure. Thanks.
Thanks, Joanna. And Sid, if you are still online, could you perhaps share a bit more about your contact hours? I know that Joanna has briefly mentioned it, but on your end, as someone who is a student, how did you manage your time in regards to handling the degree?
Yeah, I can answer that. So for me, it varied from semester to semester. On average, I'd say I'd spend around maybe 8 hours worth of lectures, either in person or online, and another 8 to 10 or 12 hours of hands-on workshops and tutorials every week. And in between those lectures and tutorials, we have time to for independent study. Yeah, I hope that helps.
Yes, thanks, Sid. That definitely provided a bit more insight into the number of hours expected, in terms of hands-on as well as workshops. So at this point of time, we do have another question that's for either Andrew or Joanna. If you could shed a bit more light on this. It's from Hannah. It's in regards to getting a bit more insights into the comparison between biostats versus health analytics. So would you say that someone with a Master of Biostatistics would have a higher chance in getting certain roles as compared to, students who did like a Master of Health Data Analytics? Are there any other careers out there besides academia?
Well,
I'll have a go at
Andrew,
answering that.
bias, yeah.
That is an excellent question, Hannah.
Mm.
Look, there is a commonality of shared skills between the two degrees, and I think in reality, employers would look for similar skills. They want to know, can you think, can you code, can you analyze data? And both of those courses will provide you with that. It's just the emphasis is different. Like, for example, in biostatistics, you'll spend one subject learning how to design and analyze randomized controlled trials. But those randomized controlled trials are typically not used in the health analytics sphere, although they're coming into sort of the commercial market. They call it online A/B testing, is really randomized controlled trials. So biostatistics has got some applications in some sort of commercial big data work with private firms. There could be, a company might have two versions of a website. Which one is the more captivating to users? And they'll do a randomized experiment. It's not couched in biostatistics terms, but it basically is biostatistics. So I think employment prospects are similar, except for the areas where they want you to be analyzing really big data sets. So like for commercial companies, when they're interested in questions that are about predictions, or health insurance companies will want profiles of their customers. Health data analytics will provide many, many more skills than a Master of Biostatistics will for that sort of role.
And I think also, I'll just add on to that, things like text analysis as well, Andrew. I think
absolutely, yes.
This unstructured data that is in health data analytics, both image and text, is not really covered in the biostatistics. But so those elements as well, where you're doing, and progression further on will end up being with things multimodal. But yeah.
Thanks, Joanna and Andrew. All right, so we do have a couple of more minutes for questions from the audience. If any of you would like to ask any more questions, we're more than happy to take questions. But in regards to the Master of Health Data Analytics, Joanna, sorry, I will need to have you on again. We did have a question in regards to the demand for jobs upon graduation. So what are you currently aware of, what the employment rate is like for graduates in this field, and what's the demand for it?
The course is relatively new. Our first graduates are coming out this year. What I do know is that I know a number of them have been going, because I speak to them every week in a workshop environment, and a number of them have been going to a variety of jobs, and from government to academia. I know within our organisation, I've had a few people contact me to get CVs from some of our students, existing students, because they're interested in the skill sets that they're offering. As far as the at the rate, no, because it's as I said, it's relatively new but growing. But if you go on and have a look on places like Seek or there's talent.com, a number of places, you can see that there's certainly a demand because of the, aged care, insurance organisations, pharmaceutical organisations. It's quite, there's quite a variety.
All right, thanks, Joanna. Yes, so we've got another question in regards to backgrounds. So we did cover, having a clinical knowledge may be valuable, but what if it's a student who has, done an honours year in research prior to this degree? Would that, add on to, would this really benefit their, their career, bringing their career to the next step?
Are you talking about health data analytics? Just
Yes,
checking.
yes.
Yeah.
Yes, that's
So,
right.
an honours student wanting to go onto a master's into health data analytics.
Yes.
It depends on that. I mean, obviously it would be beneficial, depending on and in their skill set. In the honours, what they've done is if it's in health, it certainly would, expand their horizons. I'm happy to talk to that person separately if they want to email me, if they've got more specifics of what their objectives, what they want to do after, because that's the important thing as well.
Yep, perfect. Thank you. I'll get the student to send you an email. All right, we've got one more question here. It's in regards to the starting dates for the Master of Health Management and the Master of Health Data Analytics. I'm not sure if Maida or Maria would be able to answer this, or Joanna, maybe. Yep. Oops, sorry, I can't hear you.
I can tell you that, oh, sorry, she's back. That's right.
Oh, sorry. The Master of Health Management commences, I can't remember the exact date, but we're taking applications now and it commences end of February, I think, next year. The Master of Health Data Analytics has 6 entry points. So has 6 teaching periods. So teaching period 6 commences next week, and then teaching period 1 will commence the first week in January. So if you're thinking about the Master of Health Administration, you'd have to apply now for teaching period 1 next year.
All right, thank you. And in regards to application closing dates, when would they be closed for both of
I
those
haven't got
degrees?
closing dates in front of me. We would recommend students apply as soon as possible if they're thinking of applying for our courses. But certainly for the Master of Health Data Analytics and the Master of Health Management, the university will take applications up until almost the end of February for semester 1 start.
All right, thank you. Okay, before we conclude this session, perhaps, either Andrew or Joanna, if you'd like to just quickly share what are some tips you'd like to share to future students that are considering the Health Data Analytics degree.
Tips?
Yes, for students that are considering the degree.
I think, well, from my point of view, if you I didn't play the video that I wanted to play, but I can give that to somebody for people. I can give it to people. But they talk about having a desire, a quantitative mind and a desire to research data and find unanswered questions, the answers to them. If you've got that sort of if you've got that sort of brain that you want to delve into data and answer questions, then this is a really good course for you in the health data. That's off the top of my head, but Andrew, I'm sure you might have something as well for the health data analytics.
Nothing more than your eloquent words there, Joan.
Thank you.
What about you, Chris? Have you got anything to add in regards to the health management degree?
The main tip I would say is spend time looking at the handbook and the options that you have. One of the perks of this master's is you have quite a lot of room to do additional electives. We deliberately have that flexibility built into the master's. So that allows you to tailor it towards either what your current interests are or to use this as a scaffolded, supported way to develop confidence in an area that you feel you may either need in the future or would like to learn more about now. So we are deliberately flexible. The list that we have in the handbook is good, but not even exhaustive. So depending if you think of something else that you think might be useful, we would be open to having a look at that to see whether that would fit within the masters as well. So spend time browsing and having a little look at what the offerings are. We deliberately want to be as supportive to help you develop up to be that leader in the health space that you can be. So shop around and look.
All right, thanks, Chris. Okay, we will be concluding the session in about a minute or so. But if you have further questions in regards to today's session, or if you like a recording of it, please feel free to send us an email. So I've put that email in the chat function. Feel free to take a photo or save it to your as an email draft if you like to. So we look forward to seeing you hopefully this coming semester. Thank you once again for joining us, and we wish you all the best in making a decision for your future postgrad studies. Thank you, everyone. Have a good night.